Hello, I'm here with Dr Spigg Briggs from Medical Support Offshore based in Southampton, and today we're going to be talking about medical equipment, medical preparations, telemed support and medical training. Spike, thank you very much for joining us.
It's my pleasure, thanks Paul.
The purpose of the discussion today is to prepare World Cruising Club participants with a greater awareness of what they need to be considering when planning their medical provisions when going offshore. First thing I'd like to frame with Spike is just what might happen when you're at sea on board your yacht, and how likely is that actually to happen?
Well, that's a very, very good question. Nothing like starting with the most difficult question. As a general kind of guide, about 50% of medical incidents on board are trauma related, and about 50% are illness related. So roughly, and about 50%, so looking at trauma, about 50% of incidents happen on deck, and about 50% happen below decks as well, which is something that people just don't realise. So, as an example of the risk matrix, you can see this now in front of you, and what that basically is saying that in the first line is saying that probably about once every 10,000 crew miles somebody may require some treatment, so may require usage of a medical kit. So that's like 3 people going across the Atlantic. That's the kind of thing. Requiring external advice, that's ringing a telemedical support service or another vessel close by or something like that, but looking for advice from outside the vessel, that's about 30 people going across the Atlantic. Evacuation, so that's within like 4 or 5 days, offloading, probably 300 people going across the Atlantic would be the kind of like level of risk. And life-threatening injury, about 3,000 people going across the Atlantic. So that kind of gives you an idea about, but it's a very general kind of guide, and exactly what happens, as I mentioned before, depends on the type of sailing that you're doing, the type of expedition that you're undertaking.
So one of the statistics is that about 50% of the incidents on board are going to be illness related and 50% trauma related. Just think about the illnesses. What kind of the common illnesses that you might expect could happen on board? And
well, it depends very much on the crew health. So the age, and as you get older, you get more medical baggage, of course, and you may be taking more medications, which may well change the type of illness that you may succumb to. So in terms of illnesses, as a general kind of rule, what we get is quite a lot of infections. So chest infections, which may be bacterial or viral. And because you'll be travelling around different parts of the world, and so all the bacteria and viruses in a particular port will be ones that you won't really have seen before. So there's a very good saying that what goes on board stays on board. So if you pick up like a chest infection on shore, then taking it onto the boat, it can spread through the rest of the crew, because you're living in a fairly confined kind of space. So chest infections, fungal and viral. Of course, we all know about COVID. That was a classic kind of viral chest infection. And then other infections such as urinary tract infections. So some people are very prone to getting infections in their wee. The next kind of class of things that we get are problems with the GI tract. So that's your stomach and intestines, and the 2 basic ones where either you're going too much or you're not going enough. So either diarrhea and possibly vomiting, or constipation. Constipation is a problem, so keeping nicely hydrated at sea, because it's particularly when the weather's bad, you just don't really want to drink, because then you've got to get out of your foulers to go to the toilet, or you've got to go down below, and if you're feeling sick as well, then you may not want to do that. So there's a natural kind of tendency for people not to drink quite enough when they go offshore, and we've had some really bad incidents of constipation over the years. Of course, if anybody starts to get diarrhea and vomiting, like the usual cause of that is food poisoning. Not always, but usually, and that can spread through the crew very, very easily as well. So keeping boat hygiene up to date, up to scratch all the time is very, very important indeed. Other problems like skin infections, so something called impetigo, which is a bacterial skin infection, that can spread through a crew very quickly. The other thing about GI tract is seasickness, and some people are just very prone to seasickness, and some people just aren't. But we have a scheme of treating seasickness, and part of it is just being prepared. So if you're on shore, you're going to leave, and you know that you're going to be you're prone to seasickness, starting your seasickness tablets beforehand is it's like 12 to 24 hours beforehand is very important. And actually, when you're at sea, you may have been through if you're prone to seasickness, you may have been through a period of calm weather and stopped taking your seasickness tablets. But then if there's a big weather system coming up that's going to change the sea pattern considerably, then restarting your seasickness tablets is going to be a good idea, because people can get recurrent seasickness whilst at sea. So it's not just something that just kind of goes away and then you're okay. It may come back whilst you're still at sea.
Mm-hmm. And with the seasickness, obviously it can progress and it can deteriorate quite quickly. At what point as a crew should we be concerned about a crew member that's suffering from seasickness? Obviously they go from the unable to contribute to boat chores, but then there comes a point where actually they're not recovering and it's more serious. What would be your advice of how to manage that seasickness for the crew member?
You can always keep an eye on their urine, so if it starts to turn really dark, that shows they're dehydrated. But then you start to be in the realms of taking vital signs, so looking at pulse and blood pressure, respiratory rate and things like that, and talking to a telemedical support service as well is going to be a good idea.
We talked about preparations, and there will be people going offshore that have existing conditions. They understand well how to manage them in their day-to-day lives, and there'll be those that have gone offshore in the past and experienced, for example, seasickness. It seems that the preparations is a really key element to it, that if you know you might be susceptible to those, then to take that time in your preparations to make sure you've got the right drugs that work for you, so you can prevent against it, or you can deal with it if it happens.
Yeah, that's a good point, Paul. So certainly if you have a medical condition and you're going offshore and you're dependent on tablets to control that condition, then you have to make sure that you take enough tablets plus about 50% spare tablets with you to make sure that you're properly treated whilst you're offshore.
We've talked about risk and we've talked about illnesses. Surely that risk is higher if there are illnesses that are with crew members on board that aren't known about with the crew. We'd always suggest that there's complete honesty between crew members, or at least crew member and owner skipper, with any illnesses, because that risk can therefore be reduced with good preparations and awareness that if something was to deteriorate quickly, how the crew could help in those circumstances. You've got an interesting statistic about the breakdown of incidents on board between illness and trauma, roughly about 50-50. What kind of trauma incidents are we could we possibly have on board?
About 50% of injuries happen on deck and about 50% happen below deck. So on deck, it's the kind of the obvious ones, like so people incurring blunt injuries by being washed down the deck and washing into winches and down into the cockpit and stanchions, things like that. So that's all kind of blunt injuries which can cause a significant amount of bruising, actually the bruises, because that's blood underneath the skin, can become infected and turn into abscesses. Which is a problem, and then there's obviously there's a risk of breakages of arms and legs. We see that occasionally, not hugely often. Fingers reasonably often, and then there's the other things to do with winches, so getting hands caught and fingers caught in winches, and then rope burns and things like that. And then probably the most serious one is boom versus head. On deck is something that we need to make sure that we very much avoid, because trying to deal with a closed head injury offshore is really difficult, and that's an emergency evacuation situation depending on exactly what's happened, but very difficult. So that's the kind of the trauma type of things which everybody kind of knows about on deck. Below decks, we've had quite a few blunt injuries as well, so blunt abdominal injuries, people getting thrown across the cabin. people landing on their backsides and having cracked coccyx, which is the base part of your spine. It makes it very difficult to go to the toilet, actually. So that's quite a significant problem. And then one of the main problems down below is when you're cooking, and so you've got hot liquids on the galley stove, and it depends on how your galley stove is set up. But I would certainly encourage people not to cook when they're wearing flip-flops or bare feet, but particularly if the weather's bad. So burns and scalds, very, very difficult, and very, very difficult, severe ones, very difficult to manage offshore, both from the pain point of view and also from the possible infection point of view as well. So best avoided.
It's also something that you can easily prevent with the correct clothing, maybe to protect the body against scalding, or just being really thoughtful about the dangers of hot pans and flames down below.
One of the other risks again that we see occasionally is people falling down the companionway as well, and then landing down at the bottom of on the cabin floor, and that can engender all kinds of possible injuries.
We've talked a lot about things that can happen, both illnesses and injuries. I think we should just bring it back to say, these are there are risks, but although we're concentrating on all those risks today, many people cross the Atlantic with, as your slide suggests, a really stress-free, really enjoyable time. But we always need to be prepared for these eventualities, and a lot of the time we can prevent them from happening by good preparations. So I think it's important to keep the risks of these things in mind and not be too scared off by what we're talking about this morning. So any other trauma incidents that we might need to deal with, maybe bruises or cuts? And
so in terms of the other things that we haven't talked about, trauma that can happen on above deck and below decks is cuts and lacerations and how to deal with them. Obviously, there are plenty of sharp areas on above decks, and also sharp tools as well that people may be using for different jobs. And I've seen quite a number of big lacerations from impact and also from using sharp tools on deck, and also below decks, sharp areas, and also cooking as well. We've had a few classic cases of cooks sticking knives into their hands, and also filleting fish as well. If you're fishing, then just being very careful with filleting knives, because that's another very good way of cutting yourself open. In terms of repair, it depends exactly what's happened. Generally, most medical kits will have a collection of things to repair cuts. So have antiseptic fluid to wash it, make sure it's very, very clean to start with. Well, stop bleeding to start with direct pressure usually. Then a good clean, and then repairing the cut. And most medical kits will have things like wound adhesive closure strips, skin glue, sutures, and also staples as well, potentially. So you've got a variety of things that can be used to close cuts, but it depends on how big the cut is, where it is, and the skill of the people on board. But it's not too difficult to close a cut.
Spike, thanks so much for taking us through those illnesses and injuries that could happen at sea. I think it's pretty important to remember that whilst these eventualities can happen, they don't always happen, and very often people crossing the Atlantic having a stress-free, trouble-free, incident-free crossing. But by talking about them in this session, I think it's good to raise awareness of what might happen, so we can have the preparations and the training and the equipment to deal with that incident, and that's what we're going on to talk about next.